Good evening. You are in Natural Health Talk Show. Today we're going to talk about a very important subject. Know the difference about heart disease, the ignorant sign of heart attack. Feel it, don't ignore it. We know heart disease is the leading cause of death in the United States for both men and women. You can do a lot to protect your heart and stay healthy. What is the heart? The heart is a muscular pump that's a little larger than your fist. Is one of your most important muscles as it pumps blood all over your body to the circulatory system. The most common cause of heart attack is coronary heart disease. What is coronary heart disease? Coronary heart disease is a type of heart disease where the artery of the heart cannot deliver enough oxygen, rich blood to the heart. Coronary microvascular disease is happen when the heart tiny blood vessels do not work normally and is more common in women. Coronary heart disease is the leading cause of death in the United States. About 18.2 million American adults have coronary artery disease, making it the most common type of heart disease in the United States, according to the Center for Disease Control and Prevention. Many people have no symptoms. They do not know they have coronary heart disease until they have chest pain. Blood flow to the heart is blocked, causing a heart attack, or the heart suddenly stops working, also known as cardiac arrest. For most people, coronary heart disease is preventable with a heart-healthy lifestyle. Many people have no symptoms. They do not know they have coronary heart disease until they have chest pain. Blood flow to the heart is blocked, causing a heart attack, or the heart suddenly stops working, also known as cardiac arrest. For most people, coronary heart disease is preventable with a heart-healthy lifestyle. What is a heart attack? Your heart muscle needs oxygen to survive. A heart attack occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. I'm going to repeat it for you again. A heart attack is when blood flow to the heart is blocked. It is a circulation problem. With sudden cardiac arrest, the heart malfunction and suddenly stop beating unexpected. Sudden cardiac arrest is an electrical problem. Angina occurs when your heart muscle doesn't get blood supply and oxygen that it needs. Is all chest pain? Some people ask that question to me. Is all chest pain a heart attack? No. One very common type of chest pain is called angina. It's a recurrent discomfort that usually lasts only for a few minutes. No, not all chest pain is a heart attack. One common type of chest pain is called angina. It is a recurrent discomfort that lasts only a few minutes. The difference between angina and heart attack is that angina attack don't permanently damage the heart muscle. Compare when you have a heart attack is when the blood flow to the heart is blocked. And the sudden cardiac arrest is when the heart malfunction and suddenly it stops beating. We call it an electrical problem. How is heart attack different from cardiac arrest? People often use this term to mean the same thing, but they describe different events. A heart attack can cause a cardiac arrest, and cardiac arrest, also called sudden cardiac death. Death results when the heart suddenly stops working properly. This is caused by irregular heart rhythm called arrhythmia. So the most common arrhythmia in cardiac arrest is ventricular fibrillation. This is when the heart lower chamber suddenly starts beating chaotically. It don't pump blood. Death occurs within minutes after the heart stops. The most common arrhythmia in cardiac arrest is ventricular fibrillation. And that happens when the heart lower chamber suddenly starts beating chaotically, beating fast. It don't pump blood. Death occurs within minutes after the heart stops. The key is cardiac arrest may be reversed if cardiopulmonary resuscitation is performed and a defibrillator is used within minutes to shock the heart and restore a normal rhythm. People often use the term interchangeably, but they are not synonyms. A heart attack is when the blood flow to the heart is blocked, and sudden cardiac arrest is when the heart malfunctions and suddenly stop beating. A heart attack is a circulation problem compared to the sudden cardiac arrest is an electrical problem. I'm going to repeat it again for you. Many people call me and ask me about these questions. What is the difference between a heart attack and a sudden cardiac arrest? A heart attack is when blood flow to the heart is blocked. It is a circulation problem. Sudden cardiac arrest is when the heart malfunction suddenly stop beating, unexpectedly stop beating. Sudden cardiac arrest is an electrical problem. The most common sign of heart attack is chest discomfort or pain. Or people may have pain, which can spread to your arm, neck, jaw, or back. Chest discomfort or pain can last for several minutes. They come and go. A heart attack requires emergency treatment to restore blood flow to your heart. This is an emergency. Always call 911 immediately. If you think you or someone else may be having a heart attack, remember the difference. Heart attack, the blood supply to your heart become blocked. Stop. No flow going. And you don't have not enough oxygen going to your heart. That's a circulation problem. And a person who having a heart attack is usually conscious. He will maybe complain of chest pain or other symptoms. Compare. Cardiac arrest occurs when your heart stops beating due to an electrical malfunction. So, cardiac arrest, sudden cardiac arrest, is an electrical problem. The heart stops. A person in cardiac arrest will be unconscious. He will not be able to talk, to respond, and he is not breathing. Because, I'm going to repeat it again for you, because the heart has suddenly stopped beating. A blood can no longer flow to the brain, heart, and lung. A cardiac arrest is a medical emergency. A cardiac arrest is a medical emergency. Please call 911. If you think or someone else may be having a heart attack or a sudden cardiac arrest, call 911 immediately. Start. Because if the heart is not restarted immediately, cardiac arrest can lead to brain damage and then death. Every second counts. If you witness a cardiac arrest, call 911 immediately. Give chest compression, CPR, cardiopulmonary resuscitation, and using a defibrillator, AED, can improve a person's chance of survival. What is the warning sign for heart attack? Heart attack warning sign and symptom. Recognizing the symptom of a heart attack and calling 911 could save your life or the life of a loved one. It is important that everyone, both male and female, know the warning sign and symptom of a heart attack because early treatment is vital. The longer a blockage is left untreated, the more damage occurs. The most common heart attack warning signs are chest discomfort or pain, we call it angina. And I told you before, angina occurs when your heart muscle doesn't get blood supply and oxygen that it needs. This can feel uncomfortable, pressure, itching, numbness, wheezing, fullness, or pain in your chest. This discomfort can spread to your arm, neck, jaw, or back. It can last for several minutes and come and go. The person will also feel dizziness, lightheadedness, feeling faint, or feeling anxious, nausea, indigestion, vomiting, shortness of breath, or difficulty of breathing, with or without chest discomfort, sweating, or a cold sweat. One of the biggest cardiac warning signs on people ignore, they feel it and they ignore it, is the tingling in another part of the body. If you feel it, ignore it, could mean you are at risk of an actual heart attack, because new research shows how that sensation in your feet and toe could be a warning sign. It is called small fiber neuropathy. People may feel in the lower extremity tingling, pain, and needle or numbness, more likely burning pain. The folks with the tingling were more likely to be overweight, obese, or more likely to have diabetes. Many people think when they have tingling is maybe a warning sign of out of control inflammation. But you should know, inflammation is a key driver of overall cardiovascular risk. Please, if you feel the tingling coming to you, get to the doctor for a checkup, especially if you are overdue. Please go to your doctor for a checkup. If you have that kind of tingling, not only on your feet, in another part of your body, please, it could be a sign you are at risk of an actual heart attack. There is something else that many people ignore. A powerful secret to reducing heart attack and stroke risk is hidden in your mouth. The first line of defense for your heart isn't what you think. Forget the cardiologist. We're not talking about the cardiologist right now. Go directly to your dentist to see what's going on with your heart. New research shows a powerful secret to reducing heart attack and stroke risk is hidden in your mouth. If your dentist tells you that you have a gum disease, it is a red flag that your heart and artery are in trouble too. 2 years ago, research cautioned the link between heart disease and gum disease may be coincidental. They say, just because they appear to be a link, that's not the same. For 3 years, research followed 420 gum disease patients, tracking progress of their treatment. Research also used ultrasound to measure carotid artery plaque. As their gum health improved, plaque buildup slowed significantly. Research claimed managing the periodontal bacterial profile can prevent or slow gum disease and artery disease. They believe that gum disease bacteria trigger an immune response that sets off inflammation. As we already know, when inflammation lingers and becomes chronic, it aggravates artery plaque buildup. That's when your arteries are in deep trouble. There is another killer, diet soda. They say diet soda are killer. A new study that tracked nearly 60,000 women, they find that those who drank just 2 or more diets a day had a much higher risk of dying from heart disease than those who rarely or never did drink diet soda. The results come out of data from Big Women Health Initiative study. This isn't the only study to link diet soda to deadly heart problem. In 2011, research presented at the American Stroke Association conference said drinking diet soda every day is associated with 48% higher risk of heart attack and stroke. And way back in 2008, research American Heart Association journal Circulation implicated diet soda as a cause in raising the risk of heart disease and diabetic by causing metabolic syndrome. Drugs. Many of you are asking me non-steroidal anti-inflammatory prescription drug, as well Otc Painkiller. When you have a cold or a flu, it is okay to take. I'm going to tell you, it's something you might think twice about. This kind of medication during respiratory infection can increase your risk of suffering a heart attack. For example, ibuprofen, the active ingredient in Advil and Motrin, naproxen, Fan, and Aleve and naproxen, Celebrex, Cataplan, Voltaren, and Cambia. Even aspirin has the alarm. But it seems if no one is paying attention anymore. On the top of that, the FDA issued a report revealing that those drugs, they can up your risk of heart failure, for potential of getting a heart attack or stroke. Go the longer you take them and the higher the dose. You don't have to be taking them long term to be in jeopardy, as your heart attack risk goes up even during the first week or when they use only on occasion. Despite FDA warning, those drugs are still recommended first line for treatment of cold and flu. Infectious Disease Society of America, February 2, 2017, Science Daily, state common pain reliever may increase heart attack risk during respiratory infection. Researchers from the University of Montreal, Finland, United Kingdom, cardiovascular program at Abraham and Women Hospital caution about non-steroidal anti-inflammatory drug. The bottom line is that using this drug can increase risk of suffering a heart attack by 20 to 50% compared not taking them, according to those researchers. Having a heart attack isn't the only danger those drugs pose. Previous study has found they can put on the fast track for a stroke, kidney failure, and severe stomach bleeding. The best defense of preventing heart disease starts with knowing what your risk factors are and what you can do to lower them. Having high blood pressure, high blood cholesterol, overweight or obesity, pre-diabetics or diabetic, smoke, do not get regular physical activity, have a family history of early heart disease. For example, if your father or brother was diagnosed before age 55, or your mother or sister was diagnosed before age 65, have a history of preeclampsia, which is sudden rise in blood pressure and too much protein in the urine during pregnancy, have unhealthy eating behavior, are at age 55 or older for women, or age 45 or older for men. Each risk factor increases your chance of developing heart disease. The more risk you have, the higher your overall risk is. Another thing also, please try to avoid risk of heart disease. Go to your doctor every year having a complete physical examination done, and is more important, listen to what your body is telling you. You know your body, and you know when something isn't right. When it's come to your heart, it is always better to save than sorry, because heart attack symptoms are different for everybody. The type of chest pain I will have is not the type of chest pain you will have your friend or your children or your mother or your father or your brother have. If you have discomfort, squeezing, pressure, fullness of pain in the center of your chest that lasts more than a few minutes, or that's go away and come back, is the hallmark of a heart attack. Also, you have tingling in feet, toe, another part of the body. Please, I urge you, call 911, 911, 911, stop, because you may be in the verge of having a heart attack or a sudden cardiac arrest. Remember what I tell you. Heart attack is electrical problem. Heart attack is when an artery supply the blood to your heart become blocked, stop blood flow, and reduce the amount of oxygen that get to your heart. That's a circulation problem. This person is conscious. And if that person remember what I tell you before, compare with a cardiac arrest. Cardiac arrest occurs when your heart stops beating. The heart doesn't beat anymore due to an electrical malfunction. That's an electrical problem. That person is in cardiac arrest. He's unconscious. He doesn't talk. He cannot respond, not able to respond. and he will not be breathing. Parce que the heart stopped suddenly beating. And there is no blood flow to the brain and the heart and the lung. This is an emergency. A cardiac arrest is a medical emergency. Call 911 SAT. If you think someone else may be having a heart attack, remember what I tell you? The best defense is having a good health. Eh bien, my name is Dr. Jean Grandoit. This is what I bring for you. I will bring you again in another program. Au revoir. Next time.